Countries across Europe are beginning to lift their lockdowns this week, and many are using face masks to stop a second wave of coronavirus. Well, joining me now is consultant ophthalmologist Dr. Alastair Lockwood. And Dr. Lockwood, you think we should already be routinely wearing masks?
I think it's important to look at the evidence, and one of the things that we know is that we've done a study where you can show that you can reduce the risk of contamination by that happens even just when you're talking in an area. And we know, I mean, the World Health Organization said you should wear a mask if you have a cough or you have a fever. But we know also recently that up to 50% of people who have COVID-19 may be infected yet have no symptoms. And so it really is just logical, really, to wear face masks or anything that will restrict the movement or passage of saliva in certain situations. So in areas where there are enclosed public spaces, such as supermarkets or in public transport.
And what's the science behind this? How do you know how effective face coverings are?
Well, this is actually based on a study we did back when we were looking at the use of face masks in surgical operations. We showed using coloured saliva, that when you're just talking normally through an operation, that the surgical site can be contaminated in 60% of operations if you're not wearing a face mask. And you can cut that down to 0% by wearing a face mask.
Well, Dr. Alastair Lockwood, thank you very much for your time today.